I'm here with Dr. Hal to talk about all things hormone replacement therapy. Good to talk to you, Dr. Hal.
Hey Kev, how are ya?
Doing great. Now, the first thing I'd like to talk about is why. Why are you doing this? Now, I can tell you, I did hormone replacement therapy in my early to mid 30s, and it was because I was going to the gym and I had worked out for probably 18 months and really didn't put on any lean muscle. And my trainer told me, he said, you may have really low testosterone. And I did. And I got on a treatment program and I put on massive amounts of muscle. And it was awesome. And when I was training hard, it was everything that I wanted. I noticed that I just had more oomph. It was great for sex drive. It was just great for confidence, for everything. And then when I stopped working out so hard, I just didn't think it was anything that I needed anymore. And then I started feeling a little bit sluggish and a little bit tired. I tried to overcompensate with caffeine and some things like that. Been trying to sleep better and do all that. And there still just wasn't something there. So I decided to just give it one more shot and see where my testosterone levels were. And they were back to where they had been before, just totally low. And so I figured I would give it a shot. And I got to tell you, I'm about almost 2 months into my treatments now. And I would say probably week 5 or 6, I started to feel like a different person. And my first question is, and I want to get into exactly how I felt different, but can you tell me why did it seem, because with strength, I seemed to get that pretty quickly when I really worked on that before. And now I'm not working out even like I had before, so I'm not noticing any kind of strength gains. Can you explain why maybe there might have been 5 to 6 weeks before it just really all of a sudden hit me and kicked in? How does that work that way?
Yeah, sure. So a lot of guys think that TRT is like an instant thing. It really isn't. It's not a magic bullet. You've got to do the work as well, right? If you're in a low testosterone state with testosterone deficiency, and then you have testosterone replacement, now your receptors are sort of waking up again. Let's say, right? You've been in a low testosterone state for X amount of years. We're reintroducing it back into your body. Your receptors are picking it up, and you hit on pretty much the first three reasons why most of the guys walk in the door. It's fatigue, trouble in the bedroom, and trouble in the gym. And sometimes that trouble in the bedroom translates directly into trouble in the boardroom.
Yeah, right.
Yeah, right. So we start to see the effects probably about 2 to 4 weeks in libido and mood. And then in about 3 to 6 weeks, it'll start to improve. The losing the muscle, increasing the muscle, losing the fat, and really the mental clarity. And then long-term changes continue to happen. So you will see it is gradual, but you should see, just like you did in the first 4 to 6 weeks, a pretty dramatic change, and then it continues on. Long-term, 3 to 6 months down the lane, you'll really see a body composition change, especially if you're in the gym, eating plenty of protein, getting sleep, getting rid of some of those bad habits that we pick up along the way. And you should see a marked improvement in body comp.
Now, if I could go back and tell myself 2 months ago that I was not feeling as good as I thought I was, I think there might be a lot of guys that are probably checking this out right now that really don't feel like they need it. They feel like they're okay. But one thing I had seen when I was checking out your website, when I was first thinking about doing it again, is that 40% of men by age 45 will have low T. And that basically 1 in 4 men over 30 in the US are going to have low T. And that speaks to a lot of things. And can you tell me things that they may not recognize? Because to me, the sluggishness that I had, or just, I didn't even realize what it felt like to have testosterone because it had been about 5 years. There's just kind of like an umph gear that you get with it. Can you speak a little bit to that and how some people may not even realize that they have low T and what some of those signs might be?
Well, I tell some of our patients, why don't you remember how it was when we were in our 20s, when you were in school? You would study all night, maybe go out on the weekends and hit the gym, lose the weight, eat like crap, pizza, burgers, whatever, and everything was fine if you just focused for a couple of weeks, couple of months, and your body would go back to normal. After about age 30, testosterone levels start to decline. It's a 1 to 2% decline, sometimes as high as 3% when you get a little bit older. And then all of the environmental factors that we have, the lack of exercise, the diet, sedentary lifestyle. Me as a physician, I'm sitting at a desk for hours a day. I'm not getting movement like I should. As a radio personality, the same thing. You're probably
Right.
stuck in the studio. You're not out there getting, sunlight, exercise, eating right, you order out and you pick up whatever it is. The portion sizes are much, much larger. In the 1970s, the average male weighed about 175 pounds. I think
Yeah.
today the average male weighs about 210 pounds. We're carrying
Wow.
around 40 pounds of excess weight. That
Hmm.
40 pounds of excess weight is basically like poison in your body, especially if it's
Hmm.
visceral fat. So
Yeah.
the worst kind of fat, right? And that directly correlates to low testosterone levels, because when you have a low testosterone state, and you're overweight, whatever testosterone you do have, some of it converts into estrogen in that adipose tissue, in that fatty tissue. So now you end up in this like vicious cycle of a low testosterone state, increased weight, and then that causes more low testosterone state, and that causes more weight gain. And it's something that I think we're seeing over and over. 20 There's this stat out there that says something like 20 to 30% decrease on top of the normal decline that we've seen in the last 20 to 30 years in American males. Another huge statistic that hit really close to home. Today's my birthday. I turned 45 years old today.
Hey, happy birthday.
And thank you, thank you. The average American male, we live to about 74 years old. So that means that middle age is 37.
Wow.
I don't know about you, but that hit me when I thought about that. I
Yeah.
just had a baby, last year at 43. I want to live forever because of this child.
Yeah.
And, I'm going to do whatever it takes to get to optimize my levels, whether it's hormonal, diet, exercise, all of those things that I need to do to sort of get everything in line and make sure that I'm there for my family, for my wife and for my kid, more than anything else.
I want to get into the vicious cycle you're talking about with that, because it just seems like it's piling on top of each other. So when you do hormone replacement therapy, how might that help you lose some of the weight and slim down?
So I think number one, motivation to get in the gym, right? Because it's working on your receptors where you increase confidence levels, you have more motivation, period, to get into the gym. So a lot of these guys come in and they don't have that motivation. They want to, but they just, they can't. The sluggishness, the tiredness, the fatigue, it's just not, it doesn't get them off the couch. These are the guys whose wives sometimes even bring them in because, hey, this is not my husband. This is not the guy that I married. He comes home and he's on the couch and he's vegetating. He's not chasing after the kids the way he was. On the weekends, he's taking naps and eating garbage. Those are the guys that I think are affected the easiest and the best way, is that they get that motivation back. Now you're back in the gym. It takes some time to develop good habits. It's I think 3 months is a good time frame, and in about 3 months you'll start to see body changes as well, and that sort of motivates you even more. And overall, just general wellness for higher testosterone levels.
What does HRT do for stamina endurance when you get in the gym and your performance?
So it actually, I don't want to get into too nerdy, but on a mitochondrial level, it
Yeah.
helps with the production of ATP, which is your energy, I guess the building blocks of energy, right?
Okay.
Remember that? I don't know if you remember from science class.
Yeah.
Mitochondria are the powerhouse of the cell.
Mm-hmm.
So I never thought I'd actually get to say that on the radio, but it's actually a very true statement. So it improves and sort of makes it more efficient, the mitochondrial creation of energy, and that's how you develop more stamina and more energy in the gym on a very basic level.
So you're talking about, but it's really kind of a two-part thing, and this is where I had the misconception, because I think I was off the HRT so long because it had flipped for me, where I used to put physical fitness before doing work, and then it kind of went reverse. I want to put that a little bit more forward because that's the reason why I stayed away. Speak to some things like that, because it's obvious. I think nobody's going to doubt what HRT is going to do for you when it comes to getting in the gym. But when you're sitting at that desk, one of the big things for me, talk a bit about brain fog, because I think sometimes it's not something you necessarily realize that you have, and maybe you chalk it up to getting older. So what am I going to notice if I start doing the hormone replacement therapy and I'm trying to do work with my brain?
So the mental fog is a definite improvement. You'll see that it's more a non-specific sign of low testosterone, mental fog, because that can be a normal, quote unquote, normal sign of aging. I'm not comfortable with that. There has been studies that have shown where testosterone replacement actually lowers the risk of Alzheimer's, and they looked at amyloid plaques, which is, I guess, one of the, again, I'm going very, very basic on this, that is directly correlated to Alzheimer's symptoms. And they have shown that normalizing testosterone levels, optimizing testosterone levels, actually decreases the risk of having dementia-like symptoms in the future. And that, I had a grandpa with dementia, and I've seen how ugly it can be for not just the patient, but their caretakers, their families. So if we can help prevent that, there are testosterone receptors in places that we don't even think about. Most guys walk in and they think exactly like what you mentioned: sex and gym, and that's it. But what they don't realize is you have testosterone receptors in your heart. You have testosterone receptors in your brain. It works in multitude of different ways. We've seen lipid panels improve, meaning your cholesterol levels improve. Liver function has improved with it. So there's a lot more that it does than just the gym and sexual ability.
Okay, so you've talked about all the attributes of doing the hormone replacement therapy, but there are going to be people out there skittish because of some of the things that they've grown up hearing. My first question is, we talk about testosterone now, but when I was a kid, I thought it was steroids. Is it the same thing? Is testosterone just kind of a cleaned up, more PC word for saying steroids?
So we got a ton of patients that were actually on steroids in the past and ruined their endocrine systems and the urological system, and then we've got to sort of fix things and get them back into line. When you use or abuse really anabolic steroids when you don't have a need for them, you can actually, ruin your system, your hypothalamic pituitary gonadal system. And when you're younger, it's more elastic, meaning it bounces back. And I can actually fix some of those guys. But some of the guys that were on it for years, they just need to be on testosterone replacement therapy because they've essentially burned out their system. So there is a difference between treating hypogonadal men with low testosterone and testosterone deficiency versus somebody who's using, illicit anabolic steroids that they got from their buddy in the gym.
Okay. Now, is what you serve, the testosterone, the same thing that you get if you're getting steroids from your buddy in the gym? Is it the same product?
No. We use reputable pharmacies that have been around for dozens of years, 20 plus years, some of them. And these are all regulated by the state. It's not something that, your buddy's mixing up in a bathtub and then selling in the locker room somewhere. We also don't operate like some of the, men's health typically has been a space where there's been some, I don't want to call them shady, but characters that, aren't necessarily medically trained, that don't have medical licenses, especially in the state of Florida. For some reason, there seems to be a proliferation of HRT, TRT clinics that are led by non-clinician folks that are, out there sort of spouting stuff. And, me as a physician, you can look me up. My licenses are pristine. I'm all, board of medicines. Everything's there. My credentials, my board certifications, all of those things. Some of these other folks, you're getting medical advice from somebody who actually cannot prescribe a medication. So I tell every patient that we see, whoever you've sat down with that's giving you recommendations, ask them if they're legally allowed to prescribe the medication. If they can't prescribe the medication, they can't give you management advice. So if you're meeting with a clinician and then you're sitting down with a salesperson and they're giving you recommendations, that's a big, big red flag. If you're speaking with somebody, like an RN, who, my mom's a nurse, my mom's an RN, utmost respect for them. Other places like, chiropractors' offices, again, I have some amazing friends that are chiropractors that I send patients to when they need it. But they're not allowed to prescribe medications. But in the state of Florida, it's actually a felony to prescribe and practice medicine without a license. So if you're in that sort of office and you see yourself talking to someone who's giving you advice, medical advice, or managing your medications, and their name is not on the prescription, turn around and run. That's very dangerous.
Wow. Okay.
It can get them in trouble. It can get you in trouble because you're getting medical medications, prescription controlled substances from somewhere that you shouldn't be. We're physician-led. We're board-certified physician-led. There's a ton of oversight. All of my clinicians are board-certified as well. You'll never see somebody else's name on your prescription. It'll be whoever you spoke to. You'll never get any sort of sales pitch or anything like that. We turn away more guys than we take because we treat guys that have symptoms, that have the need, not necessarily, anybody that's coming in just for a boost.
Right.
That's not what we do. So.
Well, the one thing is the testosterone level, and I know mine is low, and there should be a certain level that it hits. And I would imagine that it's very good to keep checking your levels to make sure that you're in a certain zone. Can you speak to what would be a low level, and then what does GameDay do? Do you monitor your patients after you start giving them the testosterone to make sure that they're hitting the right marks and the right levels?
We're hyper vigilant with that. So the range is going to be, and for all intents and purposes, I'm going to use the major labs have anywhere from 300 to 1,000, sometimes 1,200. Those are the total testosterone levels. That doesn't tell you the complete picture, but that's just a basic overview. So someone who is like myself, when I drop below 600, I start feeling pretty crummy. But that's also because my free testosterone is dropping at the same time. As you get older, there's something called SHBG, sex hormone binding globulin, that ties up a lot of your free testosterone, a lot of your testosterone. So you don't have that free testosterone to bind to receptors that's bioavailable to your receptors. And once that goes higher, free testosterone starts to drop. So a guy who might be a little bit older, have a higher total testosterone level, will have a higher SHBG level, and in turn have a lower free testosterone level. If the clinician can't explain that, again, maybe time to go somewhere else. So the range, I don't chase numbers. There's never going to be like, hey, I need you in this number, because your number is going to be different than my number.
All right.
It's very nuanced. During the day, testosterone levels actually vary. It can be up to 20 to 30% in guys that are younger. Guys that are younger than 40, there's a marked decline towards the end of the day. There's also, it starts to disappear when you get closer to 60 as well. Less than 10% change throughout the course of the day as well. So I look for clinical signs and symptoms or clinical response to therapy rather than just let's chase a number. But we do check on a fairly regular basis, whether it's every 6 weeks to 3 to 4 months. We have a protocol for each person that's personalized, and you may need more often and you may need less often. American Urological Association recommends 6 months to a year. We actually do a little bit more than that, but we follow guidelines as close as we can by the major publications and the major associations that are out there.
Right. Now, when I had done hormone replacement therapy before, I went into a place with a guy that was not actually really kind of like a doctor, and he sent me to a place to go get my labs done, and then I got a prescription for that, and I had to run all the way across town, and then I had to run, it all back. What is that experience like when you come into GameDay? Are we doing the same thing, or do you guys do it differently than I did?
No, so we believe that everybody should have access to their levels. So when you walk in, the first thing you're going to do is, first of all, when you walk into one of our beautiful offices, be greeted by our front desk. They should offer you a snack, make sure all your paperwork is in order, all the consents are signed, and then you get your labs drawn. That's the first thing that we do, and we do them in-house. We have a complex lab in-house that we're able to have because we have physician oversight, we have physician owners. So you'll get that drawn, you'll have your results in about 15 minutes. We do send out a much larger panel of labs, but you never have to go anywhere because we're doing that right in-house. And then you'll sit down with a clinician, board certified, and you'll go through the different treatment options if you qualify for them clinically. You'll be in and out of there between 30 and 45 minutes, and you'll have your treatment plan in hand and possibly have even gotten a treatment that same day.
Oh, wow.
Unheard of. Yeah.
Dang. Okay. So you get right on it.
Yeah.
That's really cool. Now, one thing I'd like to know is a lot of times I'll hear people bring up prostate cancer and the connections to testosterone, and I think that causes a lot of pause in a lot of people when they hear that. So how can you speak to that, and how would it and does it? Is there an actual correlation between the two?
That's probably one of the most commented things on any of the posts that we do that are educational. And people always mention, but that causes prostate cancer. And There's never been a proof. There's never been a link that it's been proven to cause prostate cancer. That was based on one study that was done back in 1941 that showed that castrated males had a decrease of testosterone levels. So they made an inverse assumption that testosterone levels will increase your risk of prostate cancer. That was based on one patient. It's never been proven. There's been thousands of patients that are tested and monitored, and it's never been proven to cause prostate cancer. And actually, one of the American Urological Association guidelines is to educate patients on that prostate cancer is not caused by high testosterone levels. It actually is protective if you're in a therapeutic range. So sometimes what we'll also get is guys that come in and they are on a protocol that is completely, unnecessary. It's actually even dangerous because they're at supra therapeutic levels, higher than what's normal for a physiological dose. Those guys are at risk of some of the scary stuff that we hear about, that prostate cancer or TRT can cause heart attacks and strokes. It absolutely can if you're dosed incorrectly and you're being monitored by someone who doesn't know what they're doing. I've had guys come in who have been at other HRT, TRT places with crazy levels, and they look great, they feel great, but they're walking, talking, ticking time bombs. And those are the guys that my friends in the ER mention. Oh yeah, by the way, I saw a guy with XYZ level in the clinic, and he mentioned that he went to ABC place, and that's where I'm really hoping. And I always say, I've got my own private practice. My wife is a physician. We're very happy in what we do. GameDay is a passion project for me. Mm-hmm. I don't care if you come to my GameDay, if you go to another GameDay, but you're going to have the same level of care, the same safety that you're going to have at any other GameDay. We all make sure that we follow the same standards of care.
Now, I talked a little bit earlier about one of the biggest things that I didn't realize I was even missing, and it's really hard to quantify. It's just that oomph, just kind of like that little extra bit of go get 'em. But I've heard of what's called roid rage, which is probably way too much go get 'em. Yep. Can you see that in levels, and is that a true thing? Is roid rage real, and how do you know at what level you're going to get that rage?
The roid rage happens at low testosterone levels and at high testosterone levels. In a high testosterone level state where you might be converting a lot more into estrogen, and then having those, the mood swings, the irritability, and then taking it out on people when it's not their fault. It's just your hormone levels are way too high. So if you go into a much higher level than that's actually healthy for you, you're going to have roid rage. If you go into a lower level that's healthy for you, you're also going to have irritability and more depressive symptoms. But yeah, it's absolutely true. And those are some of the dangers of going outside a medical practice, or going to a med spa for HRT or something like that. And again, I have friends with med spas, love them.
Right, yeah.
They're great. They do a spectacular job whenever, my wife wants to get laser done or pedicure, manicure. That's the first place that we'll go to. Aesthetically, I think they're spectacular places. I don't have any of that in my clinics because we don't know how to do that, right? So we know how to do men's health, which is why I say if you're gonna do HRT, if you're gonna do TRT, go to a place that specializes in that. Don't go to a med spa that specializes in, you open a book and there's 50 things on the menu. We just don't do that. We're focused on guys, and we're focused on HRT and erectile dysfunction and things that matter to us, right?
Tell me about the process of getting going here and the in-the-door costs. You do a consultation, you do labs, there's things you got to find out. So how much money is it going to cost to even get to that point?
There are some clinicians across the state of Florida even that you'll have to spend $500, $1,000 before you even get a treatment plan. We believe that every man should have access to their numbers. So your first consultation and your lab work, your initial lab work in-house, is complimentary. And I know it sounds crazy, but it's something that we believe in, and so yeah, we're always going to be that way.
Wow. So if you want to get in on this and start today to get on your treatments and regain that oomph that you once had, you just go online to GameDayMen'sHealth.com. Is that correct, Dr. Howe?
That is correct.
Okay.
And there's 8 locations in South Florida, from Palm Beach Gardens, West Palm Beach, all the way down to Miami.
Very cool. Thanks for taking the time today, Dr. Howe.
You got it. And Kevin, by the way, you actually look pretty amazing. I've seen the difference. Even in your face, you're starting to chisel out a
Yeah,
little bit. So.
that's what I couldn't believe was the leaning out, because I've not done anything different. Diet's the same. I'm not doing any more workout, anything, and I'm leaning out. It's crazy.
No. You just needed to normalize things, and it's completely normal to normalize things.
Yeah, that's why I wanted to speak to this, because I want guys who are probably where I was 2 months ago, didn't think they needed it, and boy, once you do it, I just say, just give it a try. You know, give it the 6 weeks, the 8 weeks, whatever, and just have that stuff go on, and tell me it doesn't make a radical difference in how you feel as a man. And that's why I wanted people to talk to, and I hope that they'll check you out and look into it for themselves.
Thank you so much, Kev.